Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408-687-1899. Anytime when you are suffering from any disease at any age, please call me for your second opinion of your disease. And if ever you are stuck up with any treatment and you don't see any progress, you can call me to find it out. What are the reasons behind that? Why the progress has stopped? So that I can guide you properly according to the nature's process. Many times I repeated in these lectures that when there was no medical science, at that time, even then, the persons were suffering from sickness and also they were cured. Who cures them? At that time, there was the vitality, there was the nature, and nature, according to his rule, cure the diseases if ever there be any means. Nature knows about all these things, and some of the diseases even at that time were increasing, developing, because at that time we himself do not know that we do not cooperate with the nature by means of our diet, by means of our living habits, all that one, because at that time the environment was not polluted as it is nowadays. But the other reasons were all acquired reasons, and the acquired reasons were concerned with the diet and concerned with the living habits. But at that time, there was nobody to guide us that this thing is wrong for your life and you should not do that. This thing is wrong for you to not to eat in this way. But nowadays, we have a knowledge because of the long way history of the medical science. We have come across those things which affects the diseases, which continue the diseases, which progress the diseases because of our diet and because of our living habits. Therefore, therefore, we should go by that one, and we should find out the reasons which are increasing the diseases, which are helping the progress of the disease. So, in this way, in our last lectures, we have discussed about the thyroid gland, and after that, we have discussed about the aneurysm. And the aneurysm I have discussed about as the ballooning of the blood vessels. In short, this is what you can explain it. The ballooning of the blood vessel is known as the aneurysm. It may happen anywhere, and the causes behind that one is the extra pressure or the weakness of the blood vessels. Because when we say the aneurysm, it means we are concerned with the blood vessels, and blood vessels are having only one purpose: to let allow the blood to flow. And let allow to blood the flow, it means there are two reasons: either something is wrong in the blood vessels, or in the wrong in the flow of blood. So in this way, basically, if we want to find it out what are the reasons behind that one, these are the two basic reasons. And you can say the pathology. Pathologically, something has changed in the structural formation of the blood vessels, and they become weak. On the other hand, there may be a more pressure in the flow of circulation of blood, which these blood vessels are unable to bear that one, maybe because of the weakness, and even maybe because of the pressure is excess. So whatever may be the reason, this is what happens inside the blood vessels. Either the blood vessels are weak or the pressure of blood is increased. In this way, our focus is to find out of these two what are the main reasons. And if the reason is behind that one is the weakness of the blood vessels, yes, we should find out the alternative to strengthen the blood vessels. And also side by side to give help, just like if broken organs, if organ is broken and we do plastering. Why do plastering? Why do bandage on the injured area of any organs? Because because we want to support that organs. And in this way the treatment procedure the treatment procedure for this one is to focus on the blood vessel strength, blood vessel power, and also to focus on the pressure of the blood which is passing through that one. So this is what the main thing is. But how blood vessels are weakened and how the pressure has been increased, if we go back to that one to find it out, that one is there may be any direct injury to any of the blood vessels, that the blood vessel may become weak and there will be extravasation of blood oozes out of the blood vessels, and that area ultimately becomes weak. Furthermore, if the pressure is more or if pressure is maintained like that one or pressure is increased, that weak area may rupture time and again or may bulge out, and that bulging out is known as a aneurysm. The other thing which is concerned with the exotoxins. Exotoxin means the food we take, whatever, not only the food. Basically, if you say tobacco is not our food, it's a habit, it's addiction. So, in this way, first of all, we should focus on our diet. What diet can help to strengthen or make the power of the blood vessels. And second thing, we have to focus on other type of chemical substances which are entering inside the body, just like the tobacco and any other drug addictions or anything like that one, which is causing damages, which is causing the weakness of the tissues. Remember, this weakness is not only in the blood vessels. This weakness is all over. But yes, because the blood vessels are the important portion of our life, and they are gradually, they are every time pressed, they are every time under pressure by the circulations. So they may rupture, they may balloon up. All this thing can happen in this space. So the basic reasons behind that one, we have considered any type of chemicals, any type of toxic substances, they can weaken the blood vessels. And any type of food, any type of intake material, just like any narcotics or the tobacco as well, they are causing the weakness of the blood vessels and also the rupturing of inside the lumens, because the blood vessels are weak and the pressure is increased. What happens inside the lumen of the blood vessel, that is ruptured. And when the inside lumen is ruptured, ultimately it hurts the muscular layer of the blood vessels. It's more painful because the inner layer has ruptured. Inner protection, which was keeping the blood circulation in alignment, that alignment has damaged and it has ruptured the inner lining of the blood vessels. And in this way, every thrust, with every palpitation, it is causing direct pressure on the blood vessels of the muscle layer of the blood vessels, and that causes pain. And it's a severe pain. And moreover, uncontrollable pain, because most of the pains which are in the other different organs, we can bind them, we can immobilize them, means the organ should not move. There is a pain when we move the hand, and we can immobilize the hand. Hand will not move, and some extent we may feel less pain in this way. And in the same way, in blood vessel circulations, we cannot help it. It's a must. Though nowadays in the heart surgery and all those things with the main blood vessels, doctors are in the habit of doing bypass surgeries. Most of the blood vessels are saved from regular pressure by applying a partial or bypass surgeries. With bypass surgery, that weaken area of the blood vessels uh, is separated. One side you can say the flow is passing bypassing that area. In this way, that either heals up, or sometimes our alternative procedures continue, just like in case of the old age. Because I told you, most of the cases of the ballooning aneurysm occurs in the old age, when by the age their blood vessels are weakened. Blood vessels are weakened, and the pressure is increased, because due to the loss of elasticity of the blood vessels, heart has to push more, put more pressure, automatic process, push more pressure to send the blood up to the tip of the fingers, up to the distal part of the body. In this way, heart had to work hard and use more force. In this way, sometimes the damaged blood vessels, sometimes the damaged blood vessel may rupture after ballooning, may rupture. And when any blood vessels, because of the aneurysm, is ruptured, it causes serious concern. It is of serious concern. And in my previous lectures, I have told you about the sign and symptoms of the internal bleeding. And here I told you about the aneurysm in the brain side. Aneurysm in the brain. That's very serious conditions. Most of the blood vessels are so compact that they do not have any space to balloon up. They do not have any space to balloon and burst up. Packed area. And that packed area is in our brain. Under these conditions, if there any blood vessels is weak, and there is increased blood pressure, because as I told you, the two-thirds of the total blood which is delivered from the left ventricle goes to the brain by the two carotid arteries, and the remaining portion of the blood goes to the whole body. In this way, a big portion, a big pressure is always maintained inside the skull and the organs. And if there be any problems, it may cause a ballooning of these blood vessels, and that's more painful, because there is no space to balloon up. Just like if I talk about the abdomen, there is a big space, there is a big elasticity, and ballooning of the blood vessels sometimes may be a bigger one as compared to the chest and as compared to the brain, because there is no vacancy. But ultimately, that kind of ballooning aneurysms are producing serious symptoms that a person cannot open his eyes. That is known as toozing, Ptoosing, toozing. That eyelids cannot open that one, and ultimately there is a swelling of the face, and also the redness of the face on different places, and in this way, puffy face, blurry vision, loss of vision even sometimes, and the dropped lids. When the dropped lids are, they are indicative that sometime, some by some or other's way, there is a pressure in the backside of that nerve, which nerve is controlling any particular area, and any particular area is controlling a nerve power, and that organ, suppose just like in the back of the optic nerve, if it happens ballooning or the rupturing or all that one, then the eyelids will show the signs of this one. But if it is near the eustachian tube, then automatically the hearing will be lost, maybe diminished, or maybe lost the hearing loss. And that may be only in one side, not the both side. The same way, the tossing or the aneurysm in the brain on one side of the brain, which is putting pressure on the eyes or the optic nerve, it is only one side. And sometimes it may be both sides. Heaviness of the head, vertigo, dizziness, nauseatic tendency, and gait is changed. When you walk like a addicted person, toxic type of persons. They cannot walk straight way if they are having this aneurysm in the brain. And the same way I told you about the aneurysms of the chest. Chest is also a compacted area, and these mostly aneurysms occurs in the mediastinal area, because the aorta or the main blood circulatory vessels are passing through the mediastinum of the chest, the middle area of the chest. And then, if there be this kind of condition, ultimately the adjoining organs, because there is a junction of many more organs, trachea, food pipes, aorta, bronchial tubes, there are many more structures. And when there is any problem in the blood vessels of the thoracic area, or even in the interior thoracic area, then under those conditions you can see the signs which organs are related to that blood vessels. That will be spoiled, just like I told you about the there is difficult respirations. If the pressure is exerted on the trachea, main trachea, or branches of the trachea, right bronchus or left bronchus, wherever the pressure is exerted, there will be a difficulty to pass on the air, oxygen, or whatever respirations. And in this way, there will be breathlessness, weakness, breathlessness. All these things can happen if there is a aneurysm inside the chest. And also, if it is affecting, or if it's very close to the lungs, it will cause the same thing, difficult breathings. And also the heart, the same way the palpitation will change, same day the blood pressure will change, and many of the things will happen under these conditions if there is an aneurysm in the chest areas. I talked about the abdominal aneurysms in the previous lectures. The aneurysm in the previous lecture is also a serious condition, but mostly there it may extend up to the internal hemorrhage in the abdomen. And the most important sign for the bleeding after the aneurysms, I have told you, when there is a swelling, just swelling, that's the ballooning of the arteries. It will put pressure on the adjoining organs. And if the adjoining organs are not working properly, it means the pressure has been exerted by the aneurysm, and that aneurysm is not allowing this organ to expand and contract to function normally. In this way, these are the signs. But if there be bleeding, if there be hemorrhage, internal hemorrhage, it will give signs to the distal part of the body. Wherever there is a ballooning, wherever there is a rupture, the distal portion means portion away from the center of the body. The distal portion will show up the sign of deficiency of food materials, deficiency of the oxygen as well. So those signs we can find it out on the distal portion of the body if there be any rupture or any, you can say, aneurysm in the abdominal areas. After that, we were discussing about this thing that it's not only in the artery, but mainly they are in the arteries and in the veins as well. This kind of aneurysm may appear in the veins, as though there is not active pressure like heart. The heart is pushing the blood very forceful, but there is not much pressure in the venous system, and venous system has been blockage wherever there is a block. But the purpose of the venous circulation is to bring garbage, to collect garbage from all the tissues of the body and send it back to the different organs in the circulation so that it be cleared, just like the carbon dioxide and other type of gases, if they are collected and when it goes to the lungs, and the lung cleans it up from the gases and put the oxygen in spite of those gases which were collected from the other tissues. So in this way, if it goes to the kidney, ultimately the kidney relieves or separates it from the from this blood, the crystal type of things, the uric acids, and all these things, they are relieved by the urine, and the other blood is sent back to the circulation. So wherever this circulating blood is gone, and whatever organ has its responsibility to evacuate the garbage, they evacuate it. So this is what's going on. We are talking about the venous system. Venous system, the pressure is less. Whereas I told you about that one. In the arterial system, the threshold, the pressure of the blood circulation is more as compared to the veins. Veins are having a passive pressure, whereas the arteries are having active pressure from the hearts. And the passive pressure is because of the contraction of the muscles and also the pressure exerted from the arterial flow, that although it is diminished as it goes further far away from the center of the body, from the heart, it becomes slow, and ultimately when it returns back by the arterial uh, blood vessels, and then sometimes there is a clogging clogging of the blood vessels due to fat, due to other type of depositions, all that one. And also I told you that in the veins, there is a different kind of structures inside of the vein, that just like we have valves. And if valves in a water pump, and we start the water pump, we work on the water pumps, water goes up, and if that thing of vessels is not ruptured, it will come out. But if that valves are weak, and the blood will ooze backward, and when it will ooze backward, ultimately it will put pressure on the back tributaries, back type of veins which are coming from the other tissues and bringing their garbage and to put into the main vessels. So in this way, then the main vessels sometimes had problem deposition of the fat, and also under those conditions there is a backward pressure in the tributaries, in the small veins, and the small veins sometimes swells up out of the skin, and we call it a varicose veins. So we call this thing as a varicose veins. And these varicose veins, blue veins, you can see in many people, mostly in the ankle and the legs and the back side and all that one, because the pressure is less. There is a big portion of the cholesterol or fat which is deposited in under the valves, on the valves of the main venal circulations, and they are unable to work properly. Under those conditions, there is a backlog, and ultimately we name it varicose veins. So, varicose veins are, on the other terms, we can say, is a pressure from the backside that the flow is not going forward, not going towards the heart properly. It is blocked over there, and when it is blocked over there, it put pressure in the backside. So ultimately, these varicose veins pumps out, visible out of skin. So these are some all other reasons I told you about that when this aneurysm. You should remember all these things. And one main important signal I told you about that one, because all peoples are addicted of the medications nowadays. Most of the, very rarely a person we can see that he's not taking any medications. After 40, we assume that nowadays all the peoples are using medicine, one or the other type of medications regularly, and it is because of the marketing of those substances, and doctors are bound to leave that and release these prescriptions for the patients, even though they are not in a serious condition. Even then they are made serious. And the limits of the standard of medical health, they are decreasing and decreasing and decreasing. Whereas the formula for the nature is for each and everything, just like the blood pressure is the main reason behind the aneurysm of the blood vessels. So first of all, if we deal with the blood pressure, so blood pressure basically goes or increase as per the age is increasing. And as per age is increasing means normal features are 100 plus age. Normal features are 100 plus age, the maximum systolic. But as I declared, as I told you, explained you in last lectures, that if you run anything, if you work anything up to the maximum limit of your strength, ultimately you will fall. Ultimately, there are some type of accidents. But if you run, you walk less than your maximum capacity, mean you are walking carefully, cautiously. Under those conditions, there are less chances or no chances that you will fall. In this way, I'm saying that if a person, the age is concerned, up to suppose a person is 50 years old, and we said 100 plus age is the maximum systolic pressures. A 50-year person should have 150 systolic pressure, but as I told you, as it will be less than from the maximum limit of the age, it will be safe. If at the age of 50 the blood pressure is going above 150, above 160 or 170, it will be more dangerous, because you are running more than your capacity is. In this way, if you are running, you are 50 years of age and your blood pressure is less than 150, it means you are not using your maximum force for this one, and it is safe. The second thing I told you about that one, that the diastolic pressure is always 40 to 50, less than the systolic pressure. As we advanced in age, the diastolic pressure and the ratio of the diastolic, because the ratio I told you that if the systolic pressure in a normal person is 140, we should decrease it to 20, so that it should be 120. It will be on a safe side. But even then, 140 is not bad for him, but better for the safety sake, we should bring it down. In this way, under aged persons, old peoples, if you will bring the blood pressure more down, ultimately the blood pressure, this pressure will not be able to pass through all the tiny blood vessels in the brain, tiny nephrons inside the kidney, and there are chances that these organs may fail. There may be dizziness, unconsciousness, forgetfulness, and kidney failures, and kidney stones, and all these things can happen ultimately. So, therefore, you should check about the uh, aneurysms, that external signs, especially in the old age. If you see blue type of patches on the skin, arms and legs, then you think that something, because of the medicine, because of the medicine or any drug you are using or tobacco you are chewing, these medicines are causing weakness of the blood vessels. And just possible, weak blood vessels can balloon out, or with the ballooning of the blood vessels regularly and with constant pressure, the inner lumen of the blood vessels may be ruptured. That may cause a severe pain, mostly in the chest area. Okay, so this is what I told you last time. So, regarding the treatments, always and always, for treatment of any disease, not only the this aneurysm or ballooning of the blood vessels, for any disease, if you know the causes of the disease, you can just say that half portion of the treatment is done. And if you are able to remove those causes, you can think over 75% of the treatment has been done. And ultimately, the sick person will start improving day by day, and ultimately he will be cured. Because the reasons behind that has been cut down. I gave last time when I was lecturing, I think in Punjabi or in Hindi, I gave one example. Suppose you are running at your maximum capacity, there are chances of any accident, and you are at that stage. Another, to let you understand easily, you have a bundle of notes, they are wrapped in the rubber, and rubber is fully tight. If you will put more notes into that one, that will broke, cracked, and there will be no bundle. But we want that blood vessels should remain in a bundle and should work as a pipe continuously. Then, if you see there is some problem, there is some ballooning somewhere inside the any part of the body, maybe brain, maybe chest, maybe abdomen, maybe somewhere else. So, first thing, if you know that this ballooning is the dilatation of the blood vessels, and it is because of high tension inside the blood vessels, what to do? You have to decrease the tension. Do has to decrease the tension. Just I was giving you the example that if there is a big bundle of notes wrapped into the tie up with the rubber, and then this is what your condition is. It's tied up. No note you can fit more into that one. That packet, you cannot fit any more any note in that one, because the elasticity of that blood vessel, that you can say the structure of the blood vessel has at the maximum dilatation reach. It cannot reach more than that one, otherwise it will follow up. So if from that bundle of nodes you take few nodes out of that easily, which is easy things, that you are relieving the tension of the rubber. In this way, if there is a blood pressure, if there is a tobacco chewing, if there is addiction of any other drugs, if there is any addiction of any medications you are taking regularly, if you taking medicine, you are having this problem. You are having these signs of aneurysm. The better thing is to withdraw the reasons what you know, that these are the reasons behind this one. These are the reasons behind my ballooning of the blood vessels. Just I told you the chemical substances, any type which they are entering into the body. That the tobacco I told you something like that one, or something regularly taking medicine because of some chronic ailments. Ultimately, they weaken the blood vessels. And now you know that at the point that you know that these are the reasons behind the ballooning of my blood vessels, and means the bundle of node, they are tightly bandaged into the rubber, and if you put some more node it will rupture. You are at that conditions, and the sign and symptoms: pressure, redness of the eyes, or here and there red patches on the skin somewhere, or you see the varicose veins type of things and all that one, or in case of brain aneurysm you see swelling of the eyes and face, closing of the eyelids. All these things you are seeing, it indicates it indicates that you are at a high tension level, that sometimes this rubber of nodes may burst out, or this ballooning of the blood vessel may rupture. So to protect that, one immediate thing is that find out the reasons and avoid those reasons. If you find out the reasons and avoid those reasons, the first thing has been done. At the same moment, at the same time, you will start feeling better. And ultimately, if you avoid those causative factors of the disease, of the ballooning of the blood vessels or the rupturing of a thing, but when there is a rupture, there is a serious condition. When there is a rupture, there is a serious condition. But before that, that's the end point, borderline, that you are having ballooning of the blood vessels. This is the condition that if you relax even a little bit, it will give you some relief. Because ballooning is not painless, it's painful. It is painful, and because the pressure is continually exerted by the heart. And when there is a pressure exerted continuously by the heart and the blood vessels, there will be pain. And second thing, that ballooning will take up the space of the other organs, and those organs will not be able to work properly. Automatically, their signs will appear over there. If ballooning in any aortic blood vessels in the chest, it may affect the respirations because it is blocking the respirations. It may affect the esophagus or the digestive systems because it is pressurizing the food pipes at that time. So in this way, we have to diagnose the condition where the ballooning is, and then adjoining sign and symptoms, we should find it out that these adjoining symptoms are concerned with respiration, with heart, with something else, and also the area in which area this ballooning is, this aneurysm is. So symptoms will appear for the adjoining organs. that they are also feeling the pain, that they are also disturbed by their functions. So in this way, try to resolve these issues, not only for the ballooning, not only for the ballooning, for every disease, for any disease. When you are suffering from any disease and you are at a peak, and at that time, if you find out that what are the reasons of my disease, what are the reasons of my this pain or uneasiness, agony, sleeplessness, indigestion, whatever, if you find it out and you relieve those causes immediately, ultimately at the same point you will start feeling better. Immediately you will start feeling better. And go on, if you continue to be protected from those substances which are damaging your blood vessels or damaging your health in any way or any reasons, then you will be traveling towards the cure. You are traveling towards the health, and from the same very movement. It will not take that long. When you start feeling mentally that, yes, I am feeling better, though still there is a condition, still there is that condition is the pertaining to the changes in the tissues, where there is a ballooning, where there is a aneurysms, how damages the tissues are, and what is their conditions. Ultimately, you have relieved the pressure immediately. You will start feeling better. But where question of cure of this blood vessels are concerned, it depends upon the tissues damaged over there. Many times in these programs, I told you that whenever you go to the doctor, your first question is, Doctor Ji, what's the name of my disease? Though you are explaining the disease, you are telling to the doctor that this is. Doctors are just to name the disease. And sometimes symptoms are of various organs, of various systems, and doctors made different diagnoses in different areas. In this way, the first question you ask to the doctor is, what is my disease? And doctor name it. Whatever you told him, doctor name it. Basically, the disease you have told the doctor. It is not the doctor, but you have told the doctor that this is the disease, and he just name it. Second question. When you go to the doctor, the second question is, okay, doctor, how long it take my disease to recover? How long I will get well? How fast I will get well? So then, the physicians are not magicians. There is a difference between magician and the physicians. Difference between that. Physicians are to work according to the nature's principle, that how a cell becomes damaged, how a cell recovers from damage, how long it takes to recover fully. And and if you know that, in spite of the doctor, what I'm doing here, I'm explaining you all these things that you should know that one. Because whenever you go to the doctor, your intention is that, okay, doctor should give me something, injection, some medicine, some, I should be relieved immediately. Relieving and cure, these are two things. Relieving temporarily does not mean that the reasons behind the disease has been cured or evacuated or separated and saved. No. The treatment is done just to give you relief. But where the question of cure is concerned, that is concerned with the tissues or cells which are damaged over there. And I told you many times, there is a separate time for each and every tissue to get repaired. If there be any damage in the any type of cells, then we have a criteria. The epithelial cells are mostly recovered within 3 to 7 days if they are not complicated. If complication upper, just like acidity, there is acidity, and because of the acidity, there are mouth sore, there are ulcers inside the mouth, and all that. And as you can mention here, oh, Dr. Gurdeep Singh told you that the epithelial cells, the lining of inner side of the mouth, are of the epithelials, and every organ inside is made up of these epithelium cells, just like inside the nose. If they have any ulceration, the time period for this one is to 3 to 7 days. But after suffering more than 3 to 7 days, a, a patient can imagine that doctor told that they should be recovered within a 3 to 7 days, and he said you will be all right in within 3 to 7 days. But I am not cured. I am still having the symptoms. It indicates that your condition, which was supposed to be recovered within 3 to 7 days, has not recovered because of the some underlying causes which are increasing the problem, the complicate. This is known as the complications. That the complications are there, that still acid is there. One thing for the cure, the causative factor should be removed immediately. Whatever. Suppose if a person is having a acidity, a regular acidity, and with a regular acidity he is having a sore mouth and all that, and unless your acidity is removed from inside, unless the causative factor of the food type things which are causing the acidity is avoided, these mouth sore will not be recovered. To recover these mouth sores, you need to find out the causes and remove those ones so that it should not be complicated. And then and only then, under those conditions, whatever the doctor said will happen, that your disease will be covered within 3 to 7 days. Just like the bone tissue, we say that if there is a fracture in the bones, the doctor said, okay, you will be recovered. You will put a plaster for 6 weeks and you will be recovered within that period. What does it mean? Because they know that the bone tissues are repaired within this periods. And if bone tissues are repaired within this period, ultimately it will be recovered. But suppose even in the bone case, you put plaster for 6 weeks, and after 6 weeks, you are still having the pain, you are still having the swelling, and even the X-ray shows that your body is not fully recovered. Under those conditions, there are some underlying causes. How the bone is formed, what the requirement of the bone formation is, to repair bone formation is. So unless you know that and you provide those things or they are there, bone will not repair within 6 weeks. But I'm talking about the natural way. Whatever is the natural way, if there is no complication, if there is no hurdle of this kind, ultimately you will be recovered within that period. Okay, you will be recovered within that period. And if there is any complications, you will not recover within a specified period of the cells or tissues which are damaged. Therefore, we must be knowledgeable about that one, that if there are sore mouth, if there are ulcers, why these ulcers are. And if we know about the why these ulcers are and we remove those causes, ultimately the day one you will start feeling better. But if the causative factors are still there, even if you are taking the medications, you may not recover. You may not recover. Temporarily, you may get relief with any medication, but ultimately the symptoms will not go away in a limited periods. And then you will again go to the doctor. Doctor, I'm not recovered. My sore mouth is recovered. The same thing happens about because we are talking about the aneurysm. These are all the examples. These are all the examples I'm giving you for the aneurysm. You should know about the causes, just I described about that one. The first thing, the weakness of the blood vessel, was the reason behind that. Second thing, the tension in the blood vessels, what's the reason behind that one? And if we know all these things and we are able to remove that one, ultimately even the ballooning may recover. And even you can survive a normal life with that one. But ultimately, in the go of life, if you again do the same thing, which were causing the ballooning, means the just like the eating chemicals and increasing the blood pressure. Blood pressure is increased by your diet, by your salt, whatever it is. Then this ballooning will not recover, but it may rupture. Serious outcome may come. But if you know the reasons behind that and you removed those reasons, the day one you will start feeling better. As I told you about the bundle of notes, tension of the rubber will be relieved at the same point when you take off some of the notes out of the bundle, rubbered bundle of the notes. In this way, every disease is produced when anything happen beyond the limit of the tissues over that, beyond the capacity of the tissues in a local area. When it is exceeding that one, those tissues are damaged, and then you see the signs of those tissues. And if those causative factors are removed, then ultimately this body will recover from that one. So, in spite of treating the things, treating the disease symptoms, we should go for the causative factors. What are the causative factors of any disease, even the aneurysm? Then you will get relief and there will be no untoward, unnecessary complications of the conditions. But if you do not know the reasons behind that one and you are treating that one forcibly, for sometimes you can give relief to the patients, but this temporary relief will not be a cure, permanent cure. And repeatedly we see the patients are coming to the doctors with the same symptoms every time and repeating the things that, doctor, whatever injection you gave me last time, whatever the medicine you gave me last time, yes, that helped me. Why not you give me the same thing? But the patient do not know about this thing, that these medications are temporarily, forcibly relieving the conditions, but not curing, because the reasons behind that one are still continued. Disease producing causes are still continued, and even the doctor did not know about that one because he has not survey of your health, survey of your body. And if he has done that one, automatically he will know that what are the things he is eating, what are the behavior in life he's maintaining, what are the liver standard he is living in, or all these things. If he knows that, then he will conclude out of this one that these are the reasons behind your disease. And if you stop this thing, from a simple example I can give you, every blood doctor to the blood pressure patient says, "Oh, don't take salt, don't take salt." Why? They are of the opinion that wherever there is a salt inside the body, depletion of the salt, collection, accumulation of the salt, it attracts moisture. It attracts more moisture around it, and it fills the more gap over there. And the blood vessels are extended, or the tissue spaces are extended, and they are producing the symptoms of the disease, and that they are increasing. the volume inside the blood vessels, because more water is attracted by the salt. And they told you not to take salt, less salt. But this is a maintenance, this is a management, this is not a treatment. The management can manage the things temporarily, but the actually thing is that why there is a excess of salt inside your body, why we are avoiding the salts, because the normal quantity of salt is not assimilated inside your blood vessels, inside the tissue spaces, inside the cell substances. And ultimately, person craves more salt. You eat salt because person craves more salt, because whatever doctors are doing, they are trying to give the medicines with which the maximum salt and minerals are relieved by the urine, by the sweating, by any means, and the body feels deficiency. That's why body craves for that one. They take more salts, and doctors, oh, you are having blood pressure, you are not to take the salt. But ultimately, the damage is inside, in the assimilation of the salt. If the normal assimilation of the salt is from the diet is, then ultimately you will not feel this kind of conditions. But you feel craving of the salt, you take more salt because there is a some problem in the assimilation. So for saying this thing, I want to convince you that in spite of advising to take less salt, you should go to correct that error, with by which the excess of salt is not assimilated in the circulation in your body. And if excess salt is assimilated inside the body, automatically you will not crave for that. You will not crave for that, and you will not have excess of salt of this one. And if the blood pressure is reasons behind salt, you will not have blood pressure. Though blood pressure is not having only one salt symptom, that there is the excess of salt, that's why every person is having blood pressure. There are many more reasons behind that one. So you should find out the reasons behind that. And if you avoid those reasons, means you are maintaining the conditions. You are maintaining the condition, not curing the condition. To advise, stop taking salt, you are maintaining the things. But why the normal? Because every substance, nature has put everything in every eatable substance. You take orange, you take mango, you take guava, you take banana, whatever. And the nature has its own composition which has been put into that one. And if you are taking those things, the normal things should be assimilated from these type of foods, these types of food substances inside your body. It means body is not assimilating from these eatable substances into the system. That's why it craves. It craves, and you put more salt, and you take more salts, and ultimately doctors say, oh, you are taking more salt, that's why you are suffering from this one. So try to understand what I want to convince you, that we should set the system, we should correct the system in spite of advising all these. No, we should know about the advices, so that you can give immediate relief to your patients. But ultimate the cure of the patient is concerned with why this deficiency is, why this craving is, the craving which is causing harm to your body, why that type of craving is there. If craving is not causing any harm to your body, it's okay. You are you are taking sugar cane, you are taking anything sweets and that, but your sugar is not increased, means they are not causing. No need to avoid those things. But if these things are increasing something, making it wrong in the systems, means they are not normally assimilated inside the body from normal food. Because every particle of the food, whatever you eat, is converted into the sugar when they are assimilated. Just like if you take protein, just for example, if you take protein, it is converted into sugar that is known as amino acid when it is added into the system. It means if you take fat, if you take carbohydrates, if you take proteins, whatever, they are having different name of the sugar when they are in the condition that they are now assimilated inside the body. And when the normal assimilated is maintained, nobody will crave for that one. Extra craving. Sometimes people do not like sweets. People do not like more salts. People do not like many of the things, just like even the pickles. You do not like it because, and somebody craves for that one, because these things are not normally assimilated from your normal diet in the body. Means something wrong is in the system. So we have to correct the system in spite of avoiding those things. Avoiding is automatically will be stopped. Avoiding automatically will be stopped because everything is fulfilled inside the body. Why you drink water? You drink water because there is a deficiency of water, of normal quantity of the water which should be inside the body. There is some deficiency. You feel thirst. You crave because the salt is not normal inside your body, and unless you complete that quantity of the salt, it automatically you will crave for salt. You crave for sweets because the sweets are not assimilated, and everybody, you take whatever type of food you take, it is assimilated inside your system in the shape of sugar. Just I told you that when you take a protein, you take an egg. This egg is assimilated inside the body only when this egg is converted into amino acid, and your fat is assimilated into the body if it is converted into amylase. And if they are not converted into that one, it means they are not assimilated into the system, and ultimately you will crave for that one. People crave for sweets, people crave for salt, people crave for different things. Why? Because those things are not assimilated, those things are not converted into sugar type of things which is capable being absorbed by the blood. And if they are not capable to be assimilated inside the blood, ultimately they will not become part of your body, and ultimately your body will crave for those things. So in spite of saying, oh, not to take salt, oh, not to take sweets, we have to correct the system so that from your normal diet, body should be capable of assimilating the substances which are required by the body. Then ultimately you will not crave for that. So today, my time is over for my lecture, and next day we will be coming to the next point of this chest, because we are passing through the chest area, and we are discussing the important diseases of the chest which can affect normally abnormality, which are you see that just like the we have discussed about the aneurysm, because the aneurysm may happen anywhere. The same thing, the diseases which are discussing may happen anywhere, but most of the important diseases which are generally happening in the chest area, we are discussing those. And next time in my next lecture we will discuss sarcoidosis. It's a new name for you, because pneumonia, pleurisy, heart attack, coronary problems, most of the things you know, because every day you suffer and every day the doctor told you. But the sarcoidosis, mostly you do not hear it. So I will discuss the sarcoidosis tomorrow in my lecture, and that lecture will be in Hindi perhaps, because today we have described in Hindi, yesterday it was in Punjabi. So tomorrow my lecture will be sarcoidosis, and that will be in Hindi. God bless you all. I am your host, Gurdeep Singh Sandhu, homeopathy consultant. And if ever you are suffering from any disease at any time and you are fed up from the treatment, call me 408-687-1899 to get your second opinion of the disease. And I can guide you according to the nature's process, how the nature was curing these diseases, and we have to follow those nature's principle to get the cure permanent. Rabaraka, God bless you. We'll see you tomorrow at the same time, California Pacific Standard Time, 5 to 6 p.m. And also, a request to all of you, if you think these lectures are beneficial for you, you are getting some knowledge of your health, of your body, then please convey this message to your nearest and dearest so that they can listen these lectures and they are also benefited from this knowledge. God bless you. Thank you all.